My name is Frank Victor Rueckl, MD. I'm a dermatologist from Las Vegas, specifically Lakes Dermatology. I've done cosmetic dermatology for about 15 years and have a separate spa as well as a dermatology office. I'm going to talk a little bit about ablative treatments to the face and neck. Skin resurfacing treatments have been around for many years. CO2 lasers, dermabrasions, fractional devices, fractional CO2 lasers. And I stopped doing them a long time ago because healing was just too difficult and the results were difficult to control. Took about a month to heal, 6 months of redness, a lot of pain, a lot of susceptibility to infections because the skin basically was burnt off. Now we have a treatment called Fractora, which is made by InMode, was also known as Invasix. I started doing treatments about a year ago and we've done hundreds of them. It works extremely well. It basically is radio frequency and it's fractionated, so it creates different length holes through the epidermis down into the dermis and puts radio wave throughout the length of that, or if you want, you can just do it at the base into the dermis. It works extremely well on wrinkles, which we've never really had a treatment for that we could do without CO2 lasers or some kind of really ablative procedure. This tightens the skin. It really does grow new collagen and elastic tissue. Suddenly you have something that does not take skin off. It creates minor injury to the skin at various depths, produces new collagen and elastic tissue, and effectively tightens the skin. At high energies, it will also take care of browns and vessels that are superficial. It can be done at low energy at the spa, or it can be done at a higher energy in my office where I actually use local anesthetic or modified tumescent type anesthesia to get into much higher energies for better results especially on severe wrinkles, say people would call smoker's lines, or severe sun damage from spending years and years and years in the sun. I do it on the face, but I also can do it on the neck. I like to separate those treatments and do it so that I can do a second area if I need to, say around the smoker's lines. It can be used off the body. It can be used for sagging skin on the legs or above the knees or the inferior buttocks, or it can be used on the abdomen for stretch marks, for loose skin after liposuction, or just plain old lax skin. When I first started doing them, I was doing them just to see what it was like, and it turned out in about 3 or 4 months that we had done about 90 different patients with excellent results. Probably average about one of these treatments a day. The other incredible thing about Fractora is that the recovery is painless. You go home, you have a little bit of bleeding, maybe some swelling, bleeding out of some of the sites, swelling from injections and from the treatment, perhaps for 2 days. The skin feels a little bit warm, but there's absolutely no pain. When I first started doing them, I was giving people pain pills and they weren't taking them, so I don't even give pain pills out anymore. The healing is quick. 2 days of swelling and redness. Generally you're a little pink by the end of the week. In 2 weeks you're fine. I usually see them at 2 weeks and there's marked improvement already. The tightening takes place over about the next month, although even at 2 weeks you can see the tightening. So it's a tremendous advantage to have a treatment that does an ablative treatment that takes care of wrinkles and tightens the skin without any significant pain or discomfort, and very, very quick healing.